Here's a clinical scenario for you with apparently an easy answer. A patient with left ventricular dysfunction associated with ischemia. That is a combination that an interventionalist or surgeon loves. I would bet that almost all of us think that revascularization is the right thing. Fix the ischemia and outcomes will improve. Or will they? Now in JACC is a study that brings that notion into question. Researchers tested the hypothesis that ischemia during stress testing has prognostic value and identifies those patients with coronary disease and left ventricular dysfunction who derive the greatest benefit from coronary artery bypass grafting compared to medical therapy. The patients came from the STITCH trial. Remember the STITCH trial? It was a trial of surgical treatment of ischemic heart failure that randomized patients with coronary disease and ejection fractions of less than 35% to CABG or medical therapy. The results, published in the New England Journal in 2009, showed that left ventricular reduction surgery added to coronary artery bypass grafting reduced the LV volume, but the anatomical change was not associated with improvement in symptoms, exercise tolerance, or even a reduction in the rate of death or hospitalization for cardiac causes. Now researchers have looked at the outcomes of 64% of the total STITCH population that had positive stress tests and were randomized to CABG or to medical therapy. And here's the curious outcome. There was no difference in outcomes between patients with and without ischemia treated with CABG or medical therapy. All-cause mortality, cardiovascular mortality, or all-cause mortality plus cardiovascular hospitalization were the same. In short, there was no interaction between ischemia and how it was treated in terms of outcome, medical therapy or revascularization. So what do we learn from this? In coronary disease with severe LV dysfunction, inducible myocardial ischemia does not identify patients with worse prognosis or those with greater benefit from CABG over optimal medical therapy. That is unexpected news for sure. I'm Peter Block, and this is a CardioSource Heart Minute.